everyone, my name is Kim. I am a registered dietitian nutritionist, a certified diabetes care and education specialist, and a certified nutrition support clinician. Welcome back to my YouTube channel. So today I have a very special guest to introduce you to. Her name is Sara, and she is a clinical pharmacist. And let me tell you, if you guys know anything about me, you know that I think that dietitians and pharmacists should work hand in hand. There's a very special place in my heart with all the clinical pharmacists that I have worked with. So I'm excited to introduce Sara to you all. So her channel is actually popping up right now. So I want you guys to go ahead, go onto her channel, check her out, subscribe, can't say that word today, and like, and also watch this video. So in today's video, she will be speaking about 6 common medication myths, which is important because a lot of people that have diabetes think that being on certain meds are bad, quote unquote bad, when in actuality, it's not. So this video is to really change your perception around medications and what they can do for individuals that have diabetes. So if you guys have any questions that you want to ask Sara, please go ahead and leave them in the comment section below or jump on over to her YouTube channel. So I'm going to stop talking and I'm going to hand it over to Sara.
Hey everyone, I'm Sara. I'm a pharmacist by trade, but my true passion is to help people with prediabetes or type 2 diabetes live healthier lives while taking fewer pills. I'm really excited to be here today on Kim's channel to talk to you about medications for diabetes and to dispel some of the myths around taking some of these meds. Before I dive in, here's a really quick but important disclaimer. Pharmacists, like myself, are not pill pushers. We are not salespeople, and we are certainly not drug dealers. I say this with a smile on my face because most of the time it's said as a joke, but I realize that medication often comes with a price tag. For a lot of people going to the pharmacy, it might become a really expensive monthly trip. So I understand the association. But as a pharmacist, I want you to know that we are healthcare professionals, which means we care about your health. If you're someone who is diagnosed with a chronic condition like diabetes, you should also know that your pharmacist can help on many levels. We can answer your questions about your condition. We can help you get a glucose meter and show you how to use it. We can give you tips on avoiding hypoglycemia, help you manage your symptoms when you're sick. We can also help you adjust your medication, your dosages, or your timing when needed. Or in some cases, we can also help in deprescribing medications, which means gradually and safely getting off certain meds. Now, I have about 11 years of experience as a community pharmacist. Kind of feel old when I say that. But in that time, I have heard many misconceptions around taking medications for diabetes. So I made a list of these myths and I'm going to share them with you in the hopes of clarifying any misconceptions that you may have. Myth number 1. I can control my diabetes with nutrition therapy, so I don't need to take medications. I'm on Kim's channel, so I had to start with one that related to nutrition. Okay, so hear me out. Personalized nutrition is an essential part of all diabetes treatment plans, and when done properly, it obviously has a huge positive impact on blood sugar management and quality of life. However, being able to manage diabetes entirely with nutrition and eating habits is not a given for everyone. So it's really important not to compare yourself or your health or your diabetes treatment with someone else's, because reality is everyone is different. Okay, stating the obvious here, but what I mean is everyone's diabetes is different. What caused the disease to develop is not the same for everyone, and how long someone's had diabetes or insulin resistance before it's actually diagnosed is also not the same for everyone. And those are all factors that influence whether or not you'll be taking medication in addition to making changes to your eating habits. So I invite you to think of medication as one of the tools in your toolbox of diabetes treatment. It's important to note here that I said one of the tools, so not the only one. Your toolbox of diabetes treatment actually includes many things. Do you have medication, lifestyle changes like nutrition and exercise? You have stress management, sleep hygiene, community support, your social circle. The best way to control your blood sugar is not just with medication, but with a combination of these tools that I just mentioned. There's no right or wrong combination here. The magic usually happens when you find the combination that works best for you specifically. Here's why medications can help you with your diabetes treatment in ways that nutrition alone can't. There are different types or classes of diabetes medications, and they each have different mechanisms of action to help you lower your blood sugar. Depending on how or where in the body they work, they can have other positive impacts on your health as well. For example, you have a class of diabetes medication called GLP-1 agonists. This class of medication can help you reduce your risk of major cardiovascular events, so we're talking about heart attacks or strokes. They can also help with weight loss or reducing your appetite, and that's all on top of lowering your blood sugar and your A1C levels. So you may have heard of some of these medications in this class, like Victoza, Ozempic, or Trulicity. Another example is the class of medication called SGLT2 inhibitors, which, other than reducing your blood sugar and your A1C, can also help with the treatment of heart failure. They can reduce the progression of kidney disease, or they can also help with weight loss as well. So this class of medications you might have heard of with names like Forxiga, Invokana, or Jardiance. By the way, I'm not even sure if I'm pronouncing these names properly. So I just gave you 2 examples of classes of diabetes medication, but there are of course many more. And as you can see, they can have different positive impacts on your health, not just on your blood sugar management. Which is why sometimes, for some people, it can be a very smart addition to their diabetes treatment plan, even though they're making changes to their nutrition. In any case, meds should always be taken in addition to creating healthy lifestyle habits. So don't be afraid to use medications as one of the tools in your toolbox to better reach your health goals. Myth number 2. Taking medication for diabetes means I have failed at making lifestyle changes. Okay, this could not be furthest from the truth. I don't know where this comes from, but I've heard it many times, and honestly, it makes me really sad to hear that people might be thinking that. Diabetes is such a complicated disease, and unfortunately, it's also a progressive disease. Now, I say this with the knowledge that yes, some people are able to reverse their diabetes when they make drastic lifestyle changes or lose an impressive amount of weight, but I think maybe we're creating confusion by saying reverse diabetes instead of put in remission. Because in reality, some people might be able to lower their A1C to the normal range and keep it there for years by maintaining really good lifestyle habits, yet their diabetes could still reappear years later through no fault of their own. Because the body evolves, hormonal change might happen, insulin resistance might reappear, maybe the pancreas starts to dysfunction for a number of different reasons that are out of our control. So no, taking medication is not a sign that you failed at making lifestyle changes. If your doctor has prescribed diabetes medications, please remember that you have not failed at anything. You are not a failure. Myth number 3. I feel fine, so I don't need to take medication. This is probably the one I hear most often. Have you heard it too? Sometimes it comes hand in hand with things like, since I feel fine, I'm going to give my body a break from all these medications and stop taking them for a while. Okay, please, 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 if you hear anyone say this, send them a link to this video. Or, tell them there's no such thing as giving your body a break from medications. It actually causes more harm than good. Remember that some of the most dangerous diseases are the silent ones, meaning the ones where we feel totally fine while they silently develop under our skin. Most of the time, we can't feel that our blood sugar is high, right? That's why we need to check on our glucose meters. The same thing happens for high blood pressure or high cholesterol. We don't feel anything when they are high. But it doesn't mean that they aren't causing us health problems. They might be impacting our heart health, our kidneys, our eyes, our sensations. So for all these reasons, it's really important to take your medications even if you feel fine. Moving on to myth number 4. I can't take this medication because my friend, cousin, or neighbor took it and it gave them horrible side effects. I've said this earlier, but I'll say it again. Please don't compare your diabetes treatments with that of someone else. Believe me, all medications have side effects, but it doesn't mean that you will get any of the listed side effects. So let's take metformin, for example. One of the most common side effects is diarrhea. Does that mean that everyone who takes metformin will have diarrhea? Nope, certainly not. Some people might even take it for years and not have any issues. So there are many factors that can cause you to develop a side effect. For example, the dose of the medication, other medication that you might be taking, your age, your gender, your kidney or your liver function, other health problems that you may have. So even if you know someone who's developed the worst side effects, it doesn't mean that you will too. By the way, it's totally okay to have concerns though, so I encourage you to talk to your doctor or your pharmacist to learn more about ways to prevent some of these side effects. If you're interested in metformin specifically, I have 2 videos on my channel about it, so you feel free to go check them out if you'd like. Myth number 5. Pharmaceutical drugs are full of nasty chemicals. It's better to take natural products instead. I have to admit, this one makes me giggle a little bit because I often feel like saying this. Look at this capsule. Does this look like a pharmaceutical drug or a natural product to you? You don't know, right? That's because it could be one or the other. This could be a natural product. I don't know if you see where I'm going with this, but this doesn't look like a plant or, something that grows in a tree, right? That's because if there were a plant or natural product that was put in this, it would have undergone many chemical transformations to be able to look like this. The difference between natural products and pharmaceuticals is that one is well controlled, well studied, approved by the FDA at certain dosages for specific indications. So those would be pharmaceutical drugs. And then you have natural or herbal products which have different regulations than drugs, and they don't need to have clinical trials for them to be approved or marketed to the public. All they need to provide is what's called reasonable evidence for their safety. Now, this is of course not at all the same level of evidence as scientific evidence provided by clinical trials. So this is a complicated topic and I could talk about it for a long time, but the point here is natural products are not always good or even safe for you. They can also have side effects, they can also be toxic, and they can also not be effective at all and just be a huge waste of your money. Myth number 6. My pharmacist keeps asking me if I take my medication every day, so all he or she must care about is how many pills they sell. I said this in my disclaimer. We pharmacists are not salespeople. If we're asking you if you're taking your meds every day, it's probably because we can see that you're not renewing your prescriptions regularly, and because we're worried that this might be causing you more harm or more side effects than you might even realize. It happens at least once a day that I get a prescription for a patient where the doctor has increased the dose of one of their meds. And when I look at the patient's file and their renewal dates, I can see that they're probably taking their pills every other day, let's say. Now, when I see this, what I tell the patient is, if you want to avoid taking a higher dose of your meds, you should really take it every day, because clearly by skipping days, the medication is not being effective. And if you did take them every day, you probably wouldn't have to increase your dose for them to have an effect. Or, you probably wouldn't need to take more meds for the same problem. So that's why myself or other pharmacists might be asking you if you're taking your medication every day, because we truly care. I hope you found this video helpful. If you enjoyed it or learned something new, please give it a thumbs up and subscribe to this channel if you haven't already. Thanks so much for having me on your channel, Kim, and thanks everyone for watching. Take care.
Thank you so much, Sarah, for doing that video. As usual, remember to comment, like, subscribe, and also hop on over to Sarah's channel where you can get more information as it relates to diabetes and medication. Until next time, bye everyone.